I'm going to have to edit the heck out of this video. So we've been talking for 9 minutes and no audio has been coming out.
Is there audio now?
Yes, there's audio now. The mic was muted.
Good job.
Let's see. Yeah, it was off. Wow.
That was a good 9 minutes, too.
We just talked 9 minutes about how to be a good salesperson and no one heard anything. Rule number 1 is unmute your mic. All right. So thank you, Carlos, for letting me know. So I guess we'll do like a 15-minute one, or we got 20 minutes. So,
I'm just curious, would we be able to add the audio or no?
What I will have to do is, no, the audio is, we were just talking to ourselves.
Oh.
Yeah. What I'm going to have to do is just all this 10 minutes of blank space of us just moving our mouths. Have to cut that out. Start from now.
You can subtitle it.
What's up, Guru Nation? We just spent 10 minutes talking to ourselves because the mic wasn't on. Now it's on. So we're talking about sales. Why researchers need to get better at sales. You know what? It might be better because we have more like condensed points now. Right?
Sure.
Not so much rambling.
You can find the silver lining if you'd like.
Some of it was rambling and then some were like good nuggets.
You have to have a 2-minute rant. So
I had a 2-minute rant, so like you're spared from that now. Man, next time. So rule number 1 of being good at sales is turn on your microphone if you're doing webinars. Without that, you
understand your technology.
Understand your technology. Good. So why are most researchers, most people in general, but obviously we're in the research space, why are they afraid of sales? Chris?
Didn't we already cover this?
Yeah, but no one heard us, man. We got to do it again. I heard you last time.
Fear of rejection.
Fear of rejection. And so I use the example of when you call a sponsor or a CRO to get studies for your research site, right?
Mm-hmm.
Business development, right? You're essentially a salesperson. And by the way, salespeople are recession-proof. A really good salesperson is recession-proof.
Yeah, I wouldn't say that's 100% true, but okay.
Yeah, we won't go off on a tangent, but a really good salesperson can earn income in any market.
Sure, it just might be less than a recession.
Sure, of course, right? So, doing business development for your site, sales, right? Then we're going to talk about contracts and budget sales. I've got examples. We were talking by ourselves for the first 9 minutes. Sorry, we're going to condense those points now. I'm calling a sponsor in September, right? September 1st. Hey, this is so-and-so at Breakthrough Clinical Trials. I noticed you have a study going on. Do you need more sites right now? We would love to participate. Yada, yada, yada. We have this many patients in our database, blah, blah, blah. Right? No, sorry, no, but we'll take your information and call you back when we do. That's BS. They never do. They never will call you back. It's up to you.
Exaggeration for effect. They do sometimes call back.
They do sometimes call back. But if you just assume they'll never call you back, because yes, some do, but you won't know who, right? Let's say 10 people tell you that and 1 or 2 call you back, but you assume all will call you back. You're missing out on 8 of those.
Oh, yeah.
Right? So, no, not right now, but we'll take your information. We'll call you back. All right, September 1st, remember? So now what I use, I have a free, this is free. It's a CRM. It's customer retention management tool called HubSpot. HubSpot, right? It's free. You put the lead in there that you talk to. You can write notes, write when you did it, and then you will remind yourself to reach out to them whenever you want. 2 weeks, I would recommend in another month because things in research move slow. So you don't want to bug them every week or every 2 weeks, although that is better than not following up at all, right? Because you'll at least get them to tell you no, and then you'll know, okay, I should follow up like a little bit longer intervals now, right? Even bugging the hell out of someone's better than not doing anything. All right, so follow up in a month. So now it's October 1st. Hey, it's Dan again. You know, do you guys still need sites for your trial, or how are things going? How's enrollment going? Oh, no, we're still okay. It's that we barely have some sites initiated, so we're waiting. Okay, cool. Thank you. November 1st. You still need sites? No, not right now. Thank you. December. No, it's first of all, in December, you're going to get voicemail. They're gone. right? They're on the holidays.
Mm-hmm.
But you follow up anyways. Leave a voicemail, follow it up with an email, right? January. Now everyone's back to work, like around the middle of January. Hey, this is Dan for. Oh, thanks, Dan. Yes, we actually do need to add on sites.
Which will happen about 90% of the time.
Right.
Most sites will need. Most studies will require add-on sites.
We need add-on sites because you know what? We did not meet our enrollment expectations. We're way behind schedule. Oh, weird. Crazy how that works. 90% of clinical trials are behind on enrollment. But the problem with this is I was rejected on September. I was rejected in October. I was rejected in November. December, I didn't even get someone to answer the phone. By January, I'm like, screw this. I'm going to do something else. Like, I'm going to go for the no. But in January, that's when they said yes, right? Most people are afraid of rejection, and they won't even do another follow-up. So CRM, HubSpot, absolutely necessary. Any kind of CRM.
And if you're opposed to learning a new software program, why don't you, adding a little color here, why don't you tell them what you used to use prior to HubSpot?
I used to use my brain.
What did the wall
look like? Yes. Thank you, Chris. So we had a wall, just like this wall here.
A large wall.
Yeah. And my CRM was printing my email follow-ups to these people, taping them on the wall, and then writing notes. I also called on this date.
Writing notes of when called.
And then when I would get a study, I would rip it off the wall and okay, throw it away. We already got that study.
Or the study's closed.
Or the study's closed, rip it off. I got lazy and sometimes just left them there.
You can literally wallpaper an entire wall.
That's right. You can do that. Yeah, you can be a moron and do that. Or you can use a CRM. So, and by the way, that wall thing's better than not doing anything.
Absolutely.
You got whatever works, right? If you want to like send smoke signals to yourself, whatever you want to do, just you've got to follow up. There's a reason why it's in my trailer. Everything is in the follow-up. The art of business development and sales is in the follow-up. Now, by the way, in our industry, and we're not going to get into how much money you can make. Maybe we'll spend the last 5 minutes on that, right? Because this is going on for a while. So sales is getting studies for your sites. It's also negotiating contracts and budgets. It's also attracting PIs and sub-Is to your sites. It's also, sales is everything, getting patients to your sites. Sales is making sure that your employees are motivated. So one of the rants I went on earlier, which I'm not going to get into that much now, when I was on mute, was business owners, for some reason, not the majority, but the majority of unsuccessful business owners, that's a better way to put it. They like to take the credit when things are going good, and as soon as things go bad, it's all of a sudden someone else's fault. Right? And that's the majority of unsuccessful business owners. The business is your responsibility. It's not your employees. Yes, you put them there to perform tasks, but you've got to be very entitled if you think that your employees should care more about your business than you do. That's just my rant. We'll move on. You want to add something?
A lot less than 2 minutes this time.
Yeah, 20 seconds. You want to add something here? Or?
No, it's very accurate.
Okay, so another example. We have a doctor who might be a client, right, in the Midwest. He's a new doctor. He's a new researcher, all right? He's an MD, prestigious, right? He's afraid of rejection. He called me.
He's not entirely new to research, though.
Okay, correct. Okay, he's been doing research for like a year.
A couple years.
But he's not getting enough study leads. He wanted us to consult for him. And then I told him, yes, we can do that. We can also get you contracts and budgets negotiated, create source docs, create SOPs, yada, yada, all our services. Free plug. Call 949-415-6256 if interested. Got to get that in there. So he said, going back to the contracts and budgets, I never negotiate anything. And I'm like, really? Why? It's like, well, I don't want to ruin my chances of getting that study or preventing myself from getting future studies. Fear of rejection, right?
Yeah.
So I said, on the contrary, if you don't negotiate your contracts, I've been told by numerous people at CROs and pharma companies that that's a red flag. this site's not experienced as they claim to be because they don't even negotiate their contracts and budgets. That's sales. And you do contract and budget negotiations all the time, right?
Almost daily now.
And do you when you first started, did you fear rejection?
No, I always enjoyed it.
You enjoyed rejection.
Well, no, I enjoy the battle.
And it is a battle, right? So you have to convince someone that, hey, this is what I need. This is our justification for this cost. I mean, that's sales. And people get afraid. They get scared of rejection. All right, so what else? Attracting PIs to your office. Okay. A lot of our clients, when they start out, don't have a PI.
Right.
So they got to go door knocking. You can also post Craigslist ads. We've done webinars on this before. You go door to door.
I think the last one we did was on this. So
yeah, the last one we did. So you know about that. If you don't, just go back and watch it. It's on YouTube. So people are afraid of rejection in person also. I mean, it's a little scarier.
Yeah, even more so. Right.
But people tend to be more rude over the phone. So it doesn't really make sense. It's just something that's hardwired in us, like in our fight or flight system, which does not apply anymore because we're not running from tigers, right? I mean, the worst they could say is no, or you can get a gatekeeper that tells you that they're not interested. And then guess what? You need to keep following up. Go back next week with a box of cookies for that gatekeeper.
It'll open that door.
It will open that door. We got that door open for 2 minutes. We got 2 minutes with the doctor. Bam, we pitched him our stuff. He decided to be a sub-I. We didn't get any patients, did we?
No.
We didn't get any patients, but the potential was there. And actually, we could have followed up more and probably got some. But that's a topic for another day. It's all in the follow-up. All of it is in the follow-up. So the good news is that I don't believe that you're born a salesperson. I believe you're born with some tendencies, like you can be an extrovert. Certainly doesn't hurt if you're an extrovert.
Oh, absolutely.
Right. But I know many introverts are good salespeople, right? That's because they're good listeners. And that's because they're more analytical sometimes. And really, at the end of the day, it's in the follow-up. Once you go from being a cold prospect to someone warm, even lukewarm, right? So this is why I like the follow-up. The first time you call someone, you're a cold call, right? But now the next time you call, you already have a relationship. It might be very brief, but you have one. And you can also email them things, send them Christmas cards. This is why I like HubSpot. You can put like reminders for their birthday. We haven't done this yet for people's birthdays, but you can, right? Send them birthday. Are you telling me that's not going to work?
Sure.
Even if it works on 1 out of 10 people.
Yeah, 10% is great. Great return.
So this is why I like follow-up, because it takes a cold prospect to a warm prospect.
Listen, it's all about just conquering fear. Because even if you're horrible at it initially, the more you do it, practice makes perfect. I mean, even if you're horrible, you still may get something.
Right.
I mean, it's just a matter of conquering fear and doing it.
Exactly. So anyone have questions? We're going to spend the next 7 minutes just going through how much money you can make in research. And the answer is?
It varies.
It varies. And it varies on who?
Typically the owner.
On you. Okay? It doesn't depend on your employees. It doesn't depend on the market. It depends on you.
Well, there are variables, I mean.
Sure. But if you run a site and you're only doing cosmetology studies, and you're not considering doing anything else, mainly because, well, it's not our core competency, but that's sometimes an excuse to disguise the fact that we're comfortable and we don't want to expand, right?
Sure. I mean,
Many times.
It can also be the doctor as well. Your PI refuses to do
your PI doesn't want to do it, but guess what? Then you got to go get another PI.
Sure.
That can do those studies.
You need to conquer your fear and go find one.
Right. So it's ultimately the business owner. It's up to you how much money you make. We just interviewed Ashley Anya, one of our clients. She's a success story. She's been with us for 8 months. She went from zero, just an idea. Actually, she approached me about being a CRA, and I told her, you actually don't want to be a CRA. After I talked to her, you don't want to be a CRA. You want to own your own site, and you could be a CRA later. She went from 0 to 6 figures in 8 months, and that was during a somewhat quiet period of studies.
Mhm.
Now there's a bunch of studies coming out. For those of you watching the future, it's September 1st, 2016. I hear that the CNS pipeline is ready to explode. I can't wait. That's our bread and butter, central nervous system. So she's a success story, right? And I mean, that's practical results. You shouldn't like shoot for the moon right away. Your first goal should be to break even always.
As a new site.
Right? As a new site, new business, whatever. Your second goal should be to pay yourself or hire an employee.
Mhm.
Your third goal should then be profit and then growth and expansion, but slowly, practically. Now, with that being said, what's the range of research sites like from your experiences? How much do they make a year?
Well, I mean, you're looking at initially startup probably at most 50,000 the first year, new site. And if you're not failing by the second year, which most new businesses fail in the first 2 years, second year, at least that, maybe 6 figures, 100, 150,000. I would say after the second year, though, most sites are profiting 200 to 500,000 a year. The average site.
Okay, and then what are some of the like moonshot companies that we've dealt with? What do they make?
That we've dealt with, or that we're aware of?
That we're aware of.
Oh, millions.
Millions a month, some of them.
Yeah. The one you're aware
Yeah,
of.
I know. Yeah, so I went to meet with the owners a couple years ago, and I was telling them my accounts receivables, and I was kind of bragging because back then we had several inpatient studies going on, and I was like, yeah, we got anywhere from 150 to 250K a month in receivables.
Mm-hmm.
And he was like, oh, we get like 4 million a month in receivables. I was like, whoa, that's crazy. So you can make a lot of money, and you can also make a very nice living. To put this in perspective, right?
Mm-hmm.
The top 1%, for those of you that know, I'm also a realtor because I love real estate. I do it on the side, but like long term, I just love real estate. So top 1% of realtors in the country
Mm-hmm.
make between 2 to 3 million a year that they net.
Mm-hmm.
That's the top 1%.
Mm-hmm.
The top 1% of research sites, there's no data on this, but I guarantee you, if you look it up, like it's in the tens of millions.
Mm-hmm.
So 10 times more,
mm-hmm.
right? With a lot less competition,
mm-hmm.
right? And now the average realtor only makes 30K a year.
Right. Which is a lot less than the average.
The average research site that can survive their first 2 years,
200 to 500K.
You can make 6 figures for yourself as the business owner, doing what you want to do, working on your own schedule, hiring a few coordinators. We know many
mm-hmm.
who work 3 days a week, have employees. They know they can make $1 million, but they don't want to because they don't want the stress. They don't want that lifestyle.
Mm-hmm.
They're good making 200K a year.
Mm-hmm.
And guess what? Top 1% of income earners in America, I think somewhere around 400K.
Yeah, 450.
450, but nobody ever aims for that.
Right.
Everybody aims for 4 million. And nobody gets that.
Mm-hmm.
Nobody gets 400K either.
Mm-hmm.
Right?
Mm-hmm.
So you got to be practical about it. But if you need help getting started with your research clinic, as I mentioned, or even just kickstarting your existing business, give us a call. We do all kinds of consulting. We have lots more success stories than just Ashley, who you saw. 949-415-6256. Follow me on every social network. Are you on any social network?
Not really.
Don't follow Chris.
Yeah, I am. I just don't check.
Don't follow Chris. Just like find his email somehow and just spam him. Text me and I'll give you his email. Yeah, like that.
Sure.
Yeah. So we want you as a client. We want to help you out. We know that you can do very well. 6 figures a year, very realistic. The problem is people either don't get to that point because they quit because there's no follow-up, or they shoot for the moon and end up with nothing.
Mm-hmm.
When you can just, with a few tweaks, make like 300 to 400K a year every year.
Sure.
Right? So
slow times you may not make that, but
200. Right. Okay. Boo-hoo.
Mm-hmm.
You know, I only made 200K this year.
Mm-hmm.
You could be a realtor that makes 20K. You could be an Uber driver that makes 30K. So that's how much you can make in real estate. We apologize for those of you who watched us just move our mouths for the first 9 minutes. Somebody told us we were on mute. So the first 10 minutes were awesome. Unfortunately, nobody can hear it. Yeah. And I should have live streamed it because then the audio would have been on there. So anyone have any questions? We're about to go. Chris is hungry. We're going to go eat some pho. And I'll leave like 30 seconds for questions. If anyone has any, we'll answer it. Otherwise, we will get going, Guru Nation. So we appreciate you guys watching. And just follow up. If you take anything away from this, it's most people give up too soon. Don't fear rejection. You should actually look forward to it. Go into each call when you're calling to get a study.
What was that successful real estate agent? What did he tell you about rejection?
Oh, he said you should be as lucky to get the door slammed shut in your face. Most people don't answer their doors.
Yeah, same principle applies in research.
Same principle.
You should be so lucky to answer the phone and talk to you.
You should be so lucky if someone picks up the phone and says, "Why the hell are you calling me? I'm busy," and hangs up. They might not have answered. Mm-hmm. And guess what? You're going to call them again next month and the month after that, and you're going to make them like you. Mm-hmm. No questions. We're going to go. Thank you, Guru Nation. Thank you very much for watching. Dan and Chris from the clinicaltrialsguru.com. Take care.